Hello, I'm Dr. Chris Hulen at KSF Orthopaedics, and I'd like to take a few minutes today to explain a couple of very common conditions that can affect you, your neck, your spine, and can really impact your quality of life. And these things can be very much misunderstood by members of the public if they're not well informed. So today, the first thing I want to talk about is something called cervical radiculopathy. You may have heard of a friend or a family member that's been diagnosed with cervical radiculopathy, maybe called a pinched nerve in the neck. And there are a lot of misconceptions I want to clear up just to help you be well informed. When we have a pinched nerve in our neck, we can have, in some cases, no neck pain at all. And what you may feel as a patient would be pain around your shoulder blade, pain in your shoulder, and pain down your arm. It typically occurs with some numbness and tingling, and you can also have weakness in your arm. This can start gradually over many months, or in some cases it can even start really suddenly. These symptoms can make it difficult for you to sleep. They can make it difficult for you to perform your functions at a job, and they can make everyday things that we all do in our homes difficult. The good news is there are very specific ways that we can analyze your condition and several different treatments that we can apply to help you get out of pain, to help you function better and sleep better and enjoy your life, which is really the ultimate goal, is to give you your quality of life back. In terms of treatment options, if I see a patient and I diagnose them with a pinched nerve in the neck, these can be surgical or non-surgical. Non-surgical treatment options are typically employed first. And for a case of a pinched nerve that's causing the types of symptoms that we've talked about already, I might prescribe medicines such as muscle relaxers or a short course of corticosteroids to help decrease inflammation that you're having because of a pinched nerve. In some cases, we also prescribe physical therapy. And when non-surgical treatments are not giving you the type of results that you need and deserve, then we will consider doing surgical treatment. In order to understand what surgical treatment is and why we would undertake surgical treatment, it's important for you to understand what causes a pinched nerve. We have more than one cause for a pinched nerve in the neck. It could be a bone spur that develops slowly over time, or it could be a disc herniation that happens suddenly. Many people have a misconception that with a pinched nerve in the neck that it has to be some type of very dramatic cause, that it has to be a terrible car crash or a sports catastrophe. But in reality, the majority of patients that come to see us with pinched nerves in their neck who require treatment simply have degenerative changes in their neck that happen slowly over time. If the cause of a pinched nerve in the neck is due to a disc herniation, we oftentimes will do an operation from the front of the neck whereby we get important structures out of the way from the front of the neck, and we then take the disc herniation, which is displaced disc material that's moved towards the nerve and towards the spinal cord, away from the nerve, away from the spinal cord, to make more room for that spinal cord and the spinal nerve. We then will put certain pieces of instrumentation in the neck that can be a very, very thin plate and a few screws to keep it in place with a spacer device. And this can be gone into in more detail in a subsequent video. My message to you today is if you're having these types of symptoms, you owe it to yourself, you owe it to your loved ones and your family members to get checked out. It'll give you peace of mind, you'll understand what's causing your problem, and you can have a menu of treatment options to choose from. In many cases, there's not a serious problem, and just having that peace of mind will allow you to get on with your life. In other cases, if there is a problem, knowing about it and taking it head on so that we can treat it for you and help you get back to that life you deserve is why we're here. If you have these symptoms and you'd like to get checked out, please give us a call. We're more than happy to help you get evaluated and treated, and we'll answer your questions. Have a great day.